So today I'm going to present a case on a study that we did in our department on the analysis of cases of different grades and types of posterior capsular opacification and correlation with pseudophakic cystoid macular edema and the choice of performing NDA capsulotomy on the basis of visual outcome. So there have been no financial support and sponsorship for this study. So as we all know, posterior capsular opacification is the most common post-operative complication of cataract extraction, and pseudophakic cystoid macular edema has also been a very common complication following both complicated and uncomplicated cataract surgery, which becomes apparent about 6 weeks following surgery. And NDA laser capsulotomy has really helped in treating the posterior capsular opacification. So the objectives of our study were to evaluate the incidence of different grades and types of posterior capsular opacification following cataract surgery and to see whether pseudophakic cystoid macular edema was present with or without PCO in reducing the visual acuity post-operatively and to take a decision on NDA capsulotomy for improving the visual acuity. So we did a very comprehensive ophthalmic examination for the patients, including to see the cystoid macular edema post-surgery by OCT-FMT. And those who developed PCO were also graded and seen, and then we had to take a decision on the NDA capsulotomy. And the patients were followed up every 2 weeks, 1 month and 3 months. So for the inclusion criteria, we included patients with cataracts like traumatic and senile who underwent small incision cataract surgery and phacoemulsification in a 1-year period from January 2021 to July 2022. A total of 50 cases were enrolled, and we looked for posterior capsular opacification within 6 weeks to 1 year of the surgery and macular edema if it has developed within 6 weeks to 12 weeks. We ruled out any other coexisting causes of macular edema. And those who had coexisting PCO and macular edema also within that period of 1 year. So we did not, in the exclusion criteria, we did not enroll cases who already had pre-existing cystoid macular edema due to any other causes like diabetes, hypertension, uveitis, complicated cataract surgery, etc. And also who developed PCO later after 1 year of surgery. So in the results of the study included that the maximum number of PCO cases were of Sommering's ring type, followed by Elschnig-Pearls and fibrous type, and maximum people with poor visual acuity belonged to the fibrous and Elschnig-Pearl type. When we did the grading of the PCO, grade 3 and 4 were more common, and with classic Elschnig-Pearls and very thick homogeneous layers. We also found 2 cases of pseudophakic macular edema in the cases. Those who had coexisting CME with PCO, such patients 4 cases we have found in our study. And after NDA capsulotomy, the vision had improved in almost 42% cases. So these were some of the cases on which the NDA capsulotomy was done. So this was also a case of PCO, which was after 7 months post-op, on which we did NDA capsulotomy at 7 months and then followed up at 8 months. And this was a case of pseudophakic macular edema, which was seen in a patient post-uneventful SICS at 2 months. So many studies have been done on this topic as of yet. The BCVA has been calculated to be maximum patients have developed 6/12 vision and better, but 24% had 6/18 vision. So many studies that have already been done has showed us that the average time interval between cataract surgery and NDA laser capsulotomy was almost 23 months. And it needs highest pulse energy in NDA capsulotomy for the fibrous type of PCO. And eyes with traumatic cataract are more likely to develop PCO. So in conclusion, mainly the BCVA of the patients that have been calculated are 6/12 or better in 76% cases, while 24% recovered to 6/18. Pseudophakic cystoid macular edema was seen in 2 patients, and coexisting both CME and PCO was found in 4 patients for whom we withheld the NDA capsulotomy and continued with anti-inflammatory eye drops and frequent steroid eye drops. So in 2 cases of fibrous PCO, NDA was tried but in vain. So these were my references. Thank you.